Please note today's session is being recorded. If you have any objections, you may disconnect at this time. Thank you very much. On behalf of the National Cancer Institute, I wish to welcome everyone to today's session. A very brief word about logistics and we'll be off. We ask that if you are not already on mute, to please keep your phone on mute for the duration of today's presentation. As mentioned, the session is being recorded and muting all lines will help us to avoid any background noise. We encourage questions. They can be submitted using the Q&A feature on the right-hand side of your screen. Please type your question in the provided field and hit submit. Feel free to submit your questions at any time, but we'll be opening the session for questions when the presentation is finished. Without any further ado, it's my pleasure to turn the meeting over to Dr. David Chambers. David?
Yes, thank you very much, Sarah, and thanks to everybody who has tuned in. As has been the case in past years, we're again very excited as a group of NIH folks to discuss with you the most recent issuance of the Trans-NIH Dissemination and Implementation Research in Health program announcements. You'll see my smiling face along with Gila and Wynn's smiling face on this slide. The three of us have been, from the perspective of the National Cancer Institute, the ones who have been working with our colleagues across the many institute centers and offices of the NIH to make sure that we can provide announcements that reflect the vibrancy of the field, the range of different studies that might be done, and also today with our colleagues from other institutes and centers and our SRO for the Dissemination, Implementation, Research, and Health Study section, that we can answer the questions that you have about this announcement and really anything that you want to know. And so, as is the case on these webinars, we do have the Q&A place where we'd love to entertain your questions. And as they come fast and furious, we'll do our best to get to as many of them as possible. But before that, we just wanted to go through some of the features of the announcement and then hear from some of our colleagues. So you'll see right here that once again, there are three different announcements, one for R01s, one for R21s, and one for R03s, the same as it has been in the past, all under the same title of Dissemination and Implementation Research in Health. Just for those of you who are new to NIH, the NIH is an umbrella of 27 different institutes and centers, as well as various offices. The institutes and centers, in some cases, are focusing around specific diseases. So you'll see reference the National Cancer Institute, the National Institute of Deafness and Communication Disorders, National Institute on Drug Abuse as examples. In other cases, the institutes reflect biological systems, the eye or dental craniofacial research. In other cases, the institutes anchor around particular populations, child health and human development, aging, minority health and health disparities, or focusing on the global nature of our research, the Fogarty International Center, and still other institutes are anchored around different sort of scientific resources, bioinformatics and imaging, or the National Center for Advancing Translational Science. ICs, of course, have both intramural programs where the research is conducted in-house, but also the extramural programs. These are announcements that are specifically for the extramural research community and, of course, are funded typically under grants or contracts. These are grants. And so just for anyone who is new, this is something that we've been doing for a while, focusing on a set of announcements that are trying to advance dissemination and implementation research at the NIH. Prior to us getting together on these trans-NIH announcements, individual institutes had their own prior announcements that they had done before, and still, in some cases, you'll see that there's a range of different announcements that might be targeting a very explicit area of an institute or a center's mission. But since 2005, we've recognized that dissemination and implementation challenges occur across all of the different areas that NIH is trying to fund, and so at that point, 8 of the institutes and centers got together to develop these first versions of the program announcements. At the same time, we were working at the NIH along with colleagues in the VA, the Agency for Research, Healthcare Research and Quality, and others around developing the D&I conferences, which we'd still encourage you to go to each and every year to get a sense of what's going on within the field and where do we need to go next. A few years later, and each year along the way, each time along the way, we've been trying to expand the terrain of the announcements. A few years later, with the second round, we had 12 institutes and centers represented. We also at that time started working more explicitly on NIH programs to train more investigators, and hopefully some of you have had a chance to participate in TITRE and other opportunities like that. The third round, we had 15 institutes and centers. The most recent one in 2016, we had 19 institutes and centers. And that brings us now to the current one where we've added two partners, the National Institute, NIAMS, National Institute of Arthritis and Musculoskeletal Diseases, and the Office of Research on Women's Health. Apologies to NIAMS if I monkeyed up the S in there. You'll see, importantly, that the different mechanisms, the different announcements have different participation from institutes and centers. And because it is both important that you're thinking about the general content of dissemination and implementation research and about a study that could be funded and could be located within a specific institute or center, that you make sure that the mechanism that you're focusing on, whether it's an R01, a larger grant, whether it's an R21, which is typically more of the exploratory developmental one, or an R03, which is the small grant program, that the institute or center that would be the likely host on the basis of the topic is signed on to that particular announcement. We'll notice also that from the beginning, we've had our NIH central offices, Office of Disease Prevention, Office of Behavioral and Social Science Research, and now newly the Office of Research on Women's Health as partners. They do not specifically hold the grants, but rather they're able to co-fund or in some cases fund a particular project that would then be hosted by one of the participating institutes or centers. So the point of this is to recognize that dissemination implementation research is important across the many different institutes and centers and offices, but also that you're very clear on who is participating for which mechanism. So just broadly, the purpose, which hasn't changed that much, but we tweak it every few years, the purpose of these announcements is really thinking about all aspects of dissemination and implementation processes once we have evidence and once we typically have evidence-based interventions. You'll see here that we're interested in identifying, understanding, and developing strategies. What can we do about the barriers that we need to overcome around adoption, adaptation, integration, scale-up, sustainability of our wide variety of evidence-based interventions, of tools, of policies, and guidelines. This has been with us from the beginning. More recently, we've also wanted to make sure that people are aware of the benefit in understanding when we need to do less. So really thinking not just about implementation, but thinking about de-implementation. When do we need to stop or reduce the use of interventions that are currently in practice, that are ineffective, that are unproven, that are low value, or worst of all, that are harmful? And so we want to make sure that our portfolio has this nice complement of studies that are also focusing on what do we do less of, what do we think about de-implementing. At the same time, from the beginning, we've always wanted to see ways in which our portfolio can advance research methods and measures, and we'd love to see your best ideas of filling gaps in our understanding of design and our understanding of valid and reliable measures. It's important, though, that while this is the purpose of the broad announcement, that the studies that you're thinking about are also within the scope of the mission of one of the institutes or centers listed. From the beginning, we wanted to make sure that given that dissemination and implementation and dissemination research and implementation research are terms that often mean different things to different people, that embedded within the announcement, we've had the way in which we've defined, again, for the purpose of the announcement, each of these two challenges. From the beginning, they've been born out of a recognition that we as a scientific community have not done a great job of disseminating our evidence and materials related to evidence-based interventions, nor have we done a great job of understanding how best to integrate our evidence-based interventions into the variety of clinical and community settings so that we can improve individual outcomes, but also ultimately benefit the health of the population. And so we have these as working definitions so that for the purpose of these announcements, you know how we are defining this terrain. Again, dissemination research deals with all of the aspects around the development, the communication, and the integration of knowledge and associated evidence-based interventions. Implementation research we define here as a much more intensive process of trying to adopt and integrate our various interventions within the variety of settings where people are trying to attain health and receive health care. And so those announcements you'll find within all three of the PARs. So just a little bit more with dissemination research. We recognize that there's so many different ways that communication, that evidence, that information can be spread. And so we are interested in the scientific base that supports how to optimize the creation, the packaging, the transmission, and the reception, and then how that evidence is turned into action to the benefit of health and of health care. And so we remain interested in this, and this traditionally, dissemination research has been a smaller part of our broad D&I portfolio. We'd love to see more in that area. Implementation research, we very briefly just define as being slightly different from your typical clinical trial where you might be testing the what. You might be thinking about a particular intervention and trying to develop an evidence base so that on this graphic, if you jump all the way to the right side, you can have some benefit on health outcomes. In this case, when we think about implementation research, we're shifting our attention from what is the intervention that needs to be provided to get those health outcomes to how do we get that intervention to be adopted, to be implemented, to be sustained over time. And so folks in our field have done a really nice job of categorizing the different implementation strategies that can be used to ideally improve upon these implementation outcomes. The argument that we've had is that if we do a good job of focusing on the how we get these evidence-based interventions to be delivered, and we see those improvements in those implementation outcomes, that we ought to see knock-on improvements in our community and our clinical services that are provided, and then in turn at the population level, we should start to see larger improvements in functioning, in reduction of symptoms, and improvement of health outcomes overall. And so just to give you a sense of, if you're new to this, this is what we're meaning in contrast to maybe the typical trial of an intervention. Dissemination and implementation research as a whole, we believe, and we have seen the benefit of the development of different theories, models, and frameworks. We believe that these theories, models, and frameworks can be helpful in identifying what are the key questions and what are some of the key outcomes that you want to focus on. That D&I research has often been a collaboration with stakeholders from multiple practice settings, people who are consuming services, their families, their social networks. It's been a team sport. That D&I research has a range of different methodological approaches, you'll see here, but that they all need to be rigorous and as relevant as possible to the circumstances in which the intervention is being tested, in which the study is being conducted. And that ideally, we've shifted to a point where we're not just thinking about kitchen sink approaches, anything that we can do to improve adoption, implementation, sustainment, but really trying to understand how and why these different strategies might work, thinking about the mechanisms underlying them, the moderators and mediators, getting away from just the crude, did we see improvement, to can we understand how and why these strategies may or may not have yielded better implementation, better dissemination, et cetera. So the next few slides really just runs down the range of different research topics that are examples and suggested but not required if you're thinking about responding to the PARs. You'll see that we have some broader topics around strategies, the implementation strategies and how we study them, that are going after a whole range of different interventions, treatments, procedures, and guidelines. Some special thoughts about that patients often have complex needs, are seen in diverse systems of care, and therefore we may not just focus on implementation of a single intervention, but we may need to be thinking about multiple interventions at once. That we'd love to see more around understanding local adaptation as interventions are being implemented, more on sustainability, certainly more reflecting that it's not just the effectiveness of implementation strategies or dissemination strategies that are important, but also the cost effectiveness of those strategies. Are they feasibly delivered given resources in a range of different settings? As I said before, we continue to be interested in more on de-implementation, more on our understanding of context and local capacity and how that influences adoption, implementation, and sustainability. We have an interest in all manner of different interventions, from those that are focused on the individual to those that are focused at the policy level, and would love to see more in that space as well. More on dissemination, more on our understanding of what's happening, not just at sort of individual or clinic, but broader organizational levels. So structure, climate, culture, and processes, which have previously been shown to affect dissemination and implementation. How can we do a better job of what strategies are going to enable more effective dissemination and implementation at the organizational level? And then, as I said before, we see this as a chance to continue to improve the field, be it the testing of various theories, models, and frameworks, either those that have been developed and untested or new ones that need a test, development of more measures, thinking more about the variety of research designs that will enable us to do a better job of answering these really important questions. Can we even think about specific subsets of methodologies, like ways in which we might be able to compare qualitative data across implementation contexts, aggregation of various data over time that will lead to further evidence, and ideally ways in which we can not just improve implementation, but accelerate the timeline from the point at which an intervention might be implemented to when we see sustained use of that intervention. And then finally, we've wanted to make sure that while there's been a lot of interest in precision medicine and thinking about advances in genomics and other sort of molecular advances, that those don't just wither following a basic discovery, but that we really think about how we disseminate the information related to genetic and genomic testing, how we implement the necessary cascade of actions that will enable somebody who might have been determined to be at high risk or carrying a particular illness with the necessary services that will optimize their health care and improve their trajectory over time. Lots of activity going on around the use of genomic information, not as much study of the implications of that at the population level or within different health and community systems. And we would just love to see more on that. So just broadly, we've seen over the years a number of ways in which successful dissemination and implementation research occurs. And so it often relies on the use, as said before, of various conceptual models that are relevant to the dissemination and implementation questions that you're taking on. They usually focus on an understanding of what incentives, facilitators, or barriers may exist within a particular setting around the use of a given intervention. As said before, focusing on the how and why, can we identify mediators, moderators, and mechanisms of action that will help us understand the impact of dissemination and implementation, recognizing that often context, be it in a community or a healthcare system, is not just at a single level, but may be may go from individual to group to organization to system to state to country and beyond. And are we considering the multi-level context as it relates to that particular question? Usually involves the development and use of a range of different key applicable outcomes, measures, and the processes of analysis. And importantly, it often requires us to think about what are the outcomes that are important to our various stakeholders, the people who are ideally making decisions on the basis of what we learn from dissemination and implementation, the people who have to make the decisions as to, are we able to use this particular practice or do we demand it? And so that's really understanding the perspectives and involving patients, families, providers, administrators, policymakers, et cetera. So
David,
just a
to jump in really quickly, if that's okay, I wanted just to acknowledge, thank you to the folks who are submitting their questions already. Again, you can do so using the Q&A feature on the right-hand side of your screen. I'm collecting them and we'll go ahead and start answering them once the presentations of the slides has finished. So thanks so much and keep it up.
Yeah, thanks. Thanks, absolutely. And you'll notice that if you're tracking the Q&A that we'll try and make sure that, we don't miss anything and that we can, and of course slides will be shared. And this will be archived. So a quick point about what's new and different. So if you were very familiar with the prior announcements and are now saying how do they differ? So first off, we do have new institute, center, and office who are involved in this. So welcome NIAMS and ORWH. It's been great to have their participation on this. We want you not to take for granted that the same institutes or centers or offices that were signed on to each mechanism is retained over time. So for example, Fogarty, the Fogarty International Center previously was just on the R03 and has now joined the R21. So don't expect that you won't find a particular institute or center or office signed on to something, but also make sure that they are before you take it for granted that it can be assigned to them. We tried in this newer announcement because at times there's been some miscommunication as to the degree to which this work is in healthcare systems exclusively or cuts across healthcare and community and public health settings. So what we tried to do is clarify that the range of settings involves an equal weight, not just for healthcare settings, but for those who are doing work in community and public health settings. And then we do have updated information on review criteria, and we do have Yvonne with us who can walk us through, who's our SRO, who can walk us through that in just a bit. And then, of course, there is guidance around the new NIH-level policies for clinical trials and how they affect these announcements, as they do pretty much every one. And then also, each time we give an opportunity for institutes and centers to have their own specific sections of the announcement where they can highlight either resources or particular priorities that they absolutely want to. And of course, as questions come up, we'd always, and we'll say this again, encourage you to follow up with the institute or center program staff contact who are there because they want to be as helpful as possible throughout this process. With that in mind, at this moment, we do want to toss it over to first Laura Pavlich from Fogarty, and then Fei Chen from NIAMS for just a couple of clarifying points for first Fogarty and then NIAMS. So Laura, do you want to, I think we need to unmute you. Oh, you're unmuted. I think you can jump in right now with Fogarty, right?
Yeah, thank you, David. So Fogarty International Center supports research and research capacity building in low and middle income countries. So we would support implementation and dissemination research that takes place in any one of these lower middle income countries as defined by the World Bank that addresses an important area of health for the country where the research takes place. We're also supportive and interested in research that catalyzes and builds on partnerships between researchers, policymakers, and program implementers in low and middle income countries to promote uptake of evidence into global health policy and practice. So that's all I wanted to clarify. Thank you.
Great, thanks. And Faye, I think you wanted to talk about the trials aspect, right?
Correct. Can you hear me okay?
Yes, perfectly.
Yes. Okay, great. Yeah, thank you, David. So, David, you were stumbling a little bit on NIAMS, what it stands for. It stands for National Institute of Arthritis, Musculoskeletal, and Skin Diseases. So that basically sums up the mission area of NIAMS.
Thank you. Sorry about that.
Yeah, yeah. So I'm really happy that NIAMS has joined this FOA with a new kid joining the party, but it's very important. So NIAMS has joined the R21 and R01 FOAs, and we will welcome all applications that are relevant to this FOA within the NIAMS mission. And the only thing that I want to clarify is that we do not accept clinical trials through these two FOAs with the primary objective of the clinical trials is clinical outcomes. But the mechanistic type of clinical trials could come through the FOA. But I would encourage anybody who has questions to talk to me or talk to the relevant POs. And if you have any questions about whether your application fits the NIAMS mission, you can send an email to me. I can send to the relevant program officer. And I think that's all I want to cover. Yeah, thank you.
Great, thanks so much. And you may notice that other folks from the NIH are on as well. And so as we get to some of the questions, we'll of course lean on them for any specific comments that they want to make. So just in keeping things moving, oh yeah, okay. So you'll see that we're now at the point to just quickly talk about the review criteria, and you'll see on the slide the review committee DIRH. We're grateful to have Yvonne here, who, as said before, is the SRO. So Yvonne, you want to?
So thank you, David. So again, I'm Yvonne Ferguson. I'm the Scientific Review Officer for the Dissemination and Implementation Research and Health Study section. So when you apply for these FOAs, those, your application will be reviewed in that study section. There are review criteria that you can find on Section 5 of the funding opportunity announcement. So I strongly encourage you to read Section 5 of that. So because there are specific review criteria, in addition to those that are listed there, there's also specific review criteria for the FOA listed there. Your application will be assessed first by the overall impact of your application, and reviewers will provide an overall impact score, and that will reflect their assessment of the likelihood of the research to exert a sustained, powerful influence on the field. And this overall impact is influenced by those 5 core review criteria that are listed on this slide: significance, investigator, innovation, approach, environment, and also additional review criteria if it's applicable to the application. So again, there are specific criteria listed in Section 5, and I strongly encourage applicants to please go and check that out. So for example, the specific questions in the FOA under each review criteria, for example, under investigators, if you look, they'll say, a question they will ask is there clear evidence of dissemination and implementation research expertise as part of the team? So again, reviewers on the committee are going to look for that expertise in those applications because that is listed as one of the specific review criteria for these FOAs. Also, in addition to those 5 core review criteria, there's also additional review criteria specifically for human subjects and protection of human subjects and inclusions. And also, if you're proposing a clinical trial, they will be assessing the study timeline in addition to the human subjects and protections and inclusion. So with the clinical trials, you might have, you are probably aware that NIH has tools for you to use in terms of determining if the application, if the science that you're proposing is a clinical trial or not. And so you should definitely go and visit that decision tool, and there's a link to that in these slides, and you will answer questions, and that tool will help you determine if, in fact, your application should be designated as a clinical trial. You'll find that there are additional forms that should be completed if you are proposing a clinical trial. There are sections there that might be different than you're used to in the past because in addition to having your research strategy and detailing your study design, your power analysis, your dissemination plan, those aspects, for example, are now found in the clinical trial application part of the application. And so I encourage you definitely to go and check that out. And those are where details of your approach would be. So in addition to completing that part of the, for example, for your approach and the research strategy, you will also complete these forms if your proposal is a clinical trial. In addition to that, there are also other resources listed on the slide. There are specific review criteria if you're proposing a clinical trial. So again, check out the FOA because that will have details of those questions that are specific to clinical trials. And reviewers use these questions as a guide to assess the clinical trial aspects of your application, just as they use those questions that are listed in the FOA that are specific to dissemination and implementation. They use those questions as a guide to assess the dissemination and implementation aspects of your application. So again, I strongly encourage you to visit Section 5 to make sure that you're addressing all of those questions that are there. And I'll pass it back to David.
Okay, thanks very much. Yeah, and as you can see on this particular slide, there is this nice website that you can go to that specifically lays out exactly what Yvonne was just talking about in terms of the trial requirements and the different resources. It has been, I would say, an evolving space, so I would expect that you'd want to bookmark that and keep returning to it as I think the NIH is trying to be as informative and as helpful as possible on this. So there actually, I noticed there was a question already that was starting to get into foreign applications at NIH, and these announcements from the beginning have always been open to any investigator anywhere around the globe and work that is conducted anywhere around the globe. So both sort of foreign investigators as well as sites for the research. So you'll see on here, these are more general considerations for foreign applications at NIH, that NIH is able to make grant awards directly to foreign institutions as opposed to just through subcontracts, that every funding opportunity announcement has specific eligibility criteria where it will say whether or not international components or international applicants are eligible. These say, as you can see here, that international applicants as well as components of foreign organizations are eligible to participate. Typically, when we're thinking about applications that are located outside of the U.S., that there's often a calculation made or trying to assess the degree to which these are both special opportunities for furthering research through the use of unusual talent, resources, population, circumstances where we can learn something from it that might not readily be available within the U.S., and importantly, that the knowledge that we gain from research should in some way be beneficial to the ultimate health of the American population as well as the local population. And so for dissemination implementation research, we've made the case that there are a lot of common questions that we can ask that will have more general implications for the range of different settings within the U.S. that might take place globally. We have a lot of under-resourced settings within the U.S. where we might recognize that low-resource settings globally might be very helpful. There also might be some similar questions around health systems that would also be relevant to, take advantage of opportunities that might exist in other places within the globe. But it is important that you try and be explicit about how you are making that case within your application and not assume that someone else is going to naturally assume, where you're coming from. So a few things to remember. Because this is more of a marathon and less of a sprint, we encourage you to start early as you're thinking about your applications. The applications can come in once every 4 months, like clockwork, but it takes a while to be able to put these together if you haven't already. And so recognizing that you should all ideally already be talking with your program officers in all caps as early as possible so that you can get initial feedback, you can understand whether this is appropriate to these or other announcements, that if you are specifically doing an R01 where you anticipate a budget for direct costs of exceeding $500,000 a year, that you need prior approval. And each institute and center may have slight variations on how they would be able to assess your request to exceed the cap and how they would then be able to return an approval for you to come in, which you would need to if you want that size of budget. We encourage you not to give short shrift to explaining the methods that you're using, the approach that you're taking with the research. From what I understand, and Yvonne can update me if this has changed, but approach has historically been the top most influential criteria in determining the overall scores of review.
That's correct.
Yeah. And so we want to make sure that you don't leave it to the imagination of reviewers because they want to know what you're planning to do. That you do demonstrate whatever partnerships you have as part of your research, and you demonstrate that you understand the context in which research is going to be, in which the research study is going to be conducted. That you do, again, can't say it enough, talk with your program officers, and where you have questions specifically about the review process, about the specific study section, you'll see that there is a part on the announcement where it lists the review contact. It lists Yvonne because we want to make sure that you have as good information about what's going to happen following the review, and once it gets submitted, the point of contact becomes the scientific review officer. So that is both helpful along the way, but particularly helpful to recognize that it sort of shifts from talking to your program staff before you submit about the application, but then once it's submitted until the review is completed, it's really in the territory, the terrain of the SRO. So we do have a couple of suggestions. If you would, and we would encourage you to, if you would be reaching out to the various program officers who are listed on these announcements, ideally, you start out by identifying who you think might be the appropriate program officer from the lists of program contacts within the FOAs. But don't be afraid to ask if they're the right person or if they might suggest that you follow up with someone else. Assuming that you found that right person, and you can always email me, I'll say that right now, and it'll be recorded forever. Email me if you have any questions. But once you've identified that specific program officer, please send them the one-pager, is what we usually like to start with. Usually your specifics aim page, even in draft form, is a nice way to help shape the conversation. What can be difficult is if that first conversation is spent with you trying to explain what your aims might be, as opposed to first saying, here's where I am. That way the program officer can reflect on it and be ready for a call to potentially discuss it, or email if you all prefer to work better that way. Ideally, you're also highlighting some of the key questions that you have. You might want to ask, and again, program officers may work differently, but we often will suggest that you ask for like a 30-minute slot, which we can usually make work pretty well. And also reflect on the fact that lots of emails come in, everybody's busy at different times, and we'd encourage you not to be shy about reminding somebody that you had sent a concept paper. It just can be that sometimes, as it happens to all of us, your email disappeared below the fold, and it wasn't anything other than an oversight, and I think at least I love to get a reminder. If you haven't heard from me, it's probably because of that, probably not because I would be avoiding responding to you. I'll speak for myself there. And so the last thing to say really, before we start to turn our attention over to the questions that you have, is that we try and make as many resources available that we hope will be helpful as you're developing your application as we can. And so there's the general NIH grants website, which has a huge amount of information. On our website, our NCI Implementation Science website, we have a fair amount of information about what we think would be helpful resources specifically related to these announcements. We have been able to also put on some of the, with the blessing of the applicants, some successfully funded dissemination implementation grants and the topics, and so you can pour through how they wrote the specific aims, how they wrote the research approach, and how they added all of that information. Anything sensitive is redacted, but most of it is up there. We do also link to the announcements if you need to find them there. And specifically, if you're focusing on submitting a grant from, outside of the U.S., there is special information for the process around the way, and you'll see this. This email is an ongoing box for you to reach us at the implementation science team at the NCI. So, with that said, thanks for listening. We have we have a number of different questions that have popped up. So I can see them, and we'll try and go through them as efficiently as I can. Remember that if we don't get to any questions before the hour is up, please do feel free to follow up via email for any of us who are contacts on the announcement with anything you want to know. So I'm just going to go as they were listed, as they came in, and feel free to keep adding questions if you have them. So the first one asks the question, a good question, for a study that focuses on the testing of theories, models, and frameworks for D&I processes for which the content of the intervention is irrelevant. How should principal investigators select an appropriate institute? So that's a great question. And there's a couple of different ways that one can think about it. What we sometimes see that while you might have a more generalizable thought about dissemination implementation processes, perhaps there is a tracer condition or a specific intervention that you would be at least initially applying this theory, model, or framework to. So it may not be that you would limit it overall. You would say, oh, this is a broad theory, model, or framework that might be relevant overall, but let's start here. Maybe my background is in cancer control, or someone else's background is in mental health, substance abuse, cardiovascular, skin diseases, et cetera. And so we'd encourage you to think about, is there a specific context that an institute might be particularly resonant with, or a particular type of intervention or type of population? Again, some of the institutes that are involved are not focused on a particular disease area, but maybe focused on a broader population or even a broader setting. And so I would just say, and others can chime in, but I would just say, think about whether there's at least a starting point in application that might be relevant to one of the institutes or centers involved. Okay. And the other thing I would just say as another, if you feel like maybe this cuts across a few different people, feel free to send it to a couple of different contacts, because you never know where something might actually be particularly valued and of interest to a given institute or center unless you ask. Okay. So we have another question that says, I'm developing an impact evaluation, mixed methods, for a public housing redevelopment project looking at a range of environmental exposures, health, and well-being outcomes. Would this be appropriate for this call? So on the basis of that information, I think some of the questions that might come up, in the dissemination implementation research space, we're trying to get a sense of what are the knowledge gaps and what are the things that we can improve upon our understanding, either about disseminating evidence, effective sort of in health information, or about integrating particular interventions, usually evidence-based within given settings. So I think what's hard to tell in terms of whether something fits and why it's so important to send that specific aims is whether underlying this impact evaluation is an implementation effort that was within, in this case, a public housing redevelopment effort that, that might have involved various health services. Because we are the National Institutes of Health, it's very important that we're ultimately trying to build improvements in health outcomes. And so I know that the questioner mentions that there's environmental exposures, which may be of great interest to the National Institute of Environmental Health Sciences. Depending on the health outcomes, they may be of interest to varying different institutes. But keying on what are the particular questions that you're trying to answer and how well do they fit in our understanding of how to better support adoption, implementation, sustainment of effective interventions, or de-implementation of things that are harmful. That would be the next level, I think, of discussion that you'd want to have. Okay.
David, do you want to go ahead and grab the next question?
Yeah, sure.
So next up here it reads, does it negatively impact an application to have a junior investigator as key personnel even when they have at least 3 years of experience using D&I approaches such as mixed methods?
So good question. I think, we usually, and Yvonne might want to weigh in, but when we usually think about the investigator criterion within review, it's usually more the team, I think. Mm-hmm. So it's thinking about who are the, what is the collective experience and expertise of the team involved. And I think at times NIH has been very vocal about wanting to make sure that there is a steady stream of earlier career or new investigators coming into the NIH who are leading, who are principal investigators on these projects. I think what you generally have a chance to do is make an argument on the basis of the scope of the project, on the basis of the approach that is being taken. If you have the necessary expertise and can justify why you'd be in a position to serve as a lead day-to-day on one of these projects, then I don't see that being a problem.
Right. I think there's also, if that person has evidence of their expertise in dissemination implementation science, then that would benefit your application. So it's not necessarily the amount of years that they've been in the field, but what products they've produced based on their expertise that the reviewers look for in terms of the team that you're proposing in terms of key personnel will make the project be successful.
Cool.
Wonderful. And I actually think that addresses three sort of interrelated questions about how we're defining expert in implementation science and is completing NIH-run training programs in implementation science qualify someone as an expert. So I think we sort of touched on how we are looking to define that as a team. And David, I know you sort of addressed this earlier, but I just want to read the question here that says, are there any constraints or suggestions for foreign investigators? So do we have any more tips or tricks? And I can jump to the next question.
Yeah, so I think one thing, and Laura, I don't know if you might want to unmute and chime in from Fogarty's perspective. I think one thing is, that if somebody has not previously become familiar with the NIH grants submission process, it's often helpful to reach out or even at times partner with institutions that have experience just, through the various bureaucratic parts of submitting and then receiving funding and managing the award. So I think that would partly depend on what sorts of resources you have within your local institute, local organization. But Laura, do you want to chime in on that?
Actually, David, that's exactly what I would have said, so I think that was perfect.
Oh, okay.
Yeah.
Thanks.
Wonderful. And so then the next question reads, do reviewers see and consider the clinical trial document?
Yes, and yes, and yes. So reviewers are trained by the scientific review officer on what to look for in terms of the application. So if you are proposing a clinical trial application, they will look for those documents and how they were completed. And there's certain sections, specifically the protocol synopsis is where we are seeing the nitty-gritty details of a clinical trial. That's where they are placed. And they definitely look at those clinical trial documents because that does affect the score.
Cool.
Wonderful. Thank you so much, Yvonne. Does anyone else on the call want to weigh in on any of the questions that we've posed so far, just to give folks an opportunity to unmute? All right. Next up, the question reads, can you discuss the review process as it pertains to D&I aspects of the application? Are the reviewers usually D&I experts or not?
So as a scientific review officer, what their job is to make sure that all the applications are reviewed and have fair, unbiased expert reviewers that are part of the panel each round. And so the unique part about the Dissemination and Implementation Research and Health Study section is that you have those dissemination and implementation science experts there. You also have subject matter expertise. So just like the questions that we've seen on the call, dissemination and implementation research, the methods and the strategies and the techniques are common, but the areas of expertise in terms of what you're proposing are very broad. And so not only, for example, if an application comes to, your application comes to the study section, you'll have someone on that, of the three assigned reviewers, you'll have someone that has that dissemination implementation science expertise, but you'll also have someone that has that subject matter expertise that is also a reviewer on that application. And so we make sure that all the applications receive the expertise that is required for the science that you're proposing. And I do want to emphasize to all the potential PIs on the line that there is an assignment form, the PHS assignment form, where not only can you put your preferred centers, institutes, you can also, there's a section where you can put your preferred expertise in terms of review. So a lot of times the scientific review officer will look at that form to see what the applicant has put in terms of the expertise. They might have to have agent-based modeling expertise, or you might want someone who has community engagement expertise on that form. And so that's helpful for review in terms of finding experts for your application.
Yeah, and I think what it means, though, is that you probably shouldn't assume that people can read into your mind. And so given the diversity of expertise that's needed on a lot of applications and thus constitutes the review committee, that you're aware that some people will primarily be focusing on D&I research overall, and as Yvonne said, others may have a particular expertise that's crucial to the application, but you would not want to assume that they have as deep an understanding as others, right?
Correct.
Yeah, okay. Thanks.
Wonderful. And so with our last few minutes together, I'm going to try and do a rapid fire questions. So, one, will extension infrastructure testing and improvement that can facilitate physical activity effective programs, D&I, be of interest to these PARs?
Oh, I'm sorry. My thing just froze. So I was trying to read along with you, and it just okay. Sorry, give me 1 sec on that, and then...
So while you're considering that, I think we've covered this, but just a quick one. Will each institute have their own program officer for this, or will there be a single PO?
Each institute, it's a good question. And what usually, I'll just speak for mine, but it varies. In some cases, it's one person who ends up managing that portfolio. In other institutes and centers, it fans out by what might be a sub-theme within it. And so is it more physical activity or cancer screening for us? It would go to different people.
Perfect.
And I'm sorry, that previous one, okay, is still, okay. It just came back. Was that on a different,
So we have some questions coming into the chat and some through Q&A, but that is quite all right. I think that the extension infrastructure question was sort of neatly answered by your earlier response to well-being.
Yeah, okay. Yeah, so again, I think, broadly, they're sort of as long as it's broadly relevant to dissemination implementation processes, which it sounds like it is in this case, although targeted to physical activity. It seems like it would be of general interest, and then again, the follow-up would be to identify the institute or center that you think might be most interested in this, and then have the follow-up conversation with them about the specific approach that you want to take. Yeah,
perfect.
Okay. You're right. Those were the chat questions. Okay.
Awesome. So can a project have 2 lead investigators?
Yes. So all of the announcements are open to the multiple principal investigator, MPI, and absolutely, I think you can have more than 2, but at some point it gets problematic.
Wonderful. Next question reads, I'll be applying as part of a nonprofit organization. Will our application be scored in the same group with academic institutions, or are we scored with comparable organizations?
So that it'll be scored with all the other organizations. It depends. So it'll be scored with everyone. It won't be in a separate section or cluster for review.
How long does it take POs to respond to inquiries on the review proposals? And so I'm not sure if that means just when you send a one-pager or for a more in-depth response. But I think I would stick with, David, your answer about emailing, sending the one-pager, then sending follow-up reminders.
Yeah, and I think what's always hard for everyone on outside inside is that there are certain times where there's people may be traveling for and it may take a little bit longer, so it's a little bit hard to standardize. I know that folks really try not to let their inbox get too messy, and so try to respond to things as quickly as possible. But I would say that if you haven't heard within a week, that it would probably be good to send that follow-up just in case. And you may see that out-of-office message as well, and that can give you a good signal too.
Wonderful. Next reads, can you apply with this same general concept for different awards? R21 for new technology component, while also for an R01 for scaling the previous technology? Or can an R01 for a dissemination implementation have a new innovation included to aid/spur scaling?
Yeah, so it's a great question, and I think the mechanisms are really trying to get at different things. The R01 is the most flexible, but generally R01s are more definitive studies taking on a particular question, feeling like at the end of the day, it's not about acceptability or feasibility, it's about the outcomes of a particular effort. The R21s are more trying to develop toward an R01. So it would be a specific set of aims that would lead someone to be able to say, I now have the data, I now have the feasibility to argue that I should be ready for that larger project. The R03 is really more of a small grant, a small project where you would still be able to answer a question, but it's not necessarily as developmental. Given that, when you have the general same research agenda, you'd want to make sure that you could divide it up into severable pieces, some of which would be relevant for different mechanisms. You really can't have the same scope exactly being submitted in different places at the same time. And it doesn't quite make sense to have such an overlap, because if it's really exploratory developmental, then you want to go the R21. If it's a bigger one, you want to go the R01. But again, a really great thing to follow up both with your broader research agenda, but what is the subset of activities that you want to put into an R21 or an R01 specific aims.
Wonderful. And so with that, I want to take a moment to thank all of our speakers on the line, David, you included, but to all of those who were available to answer questions and to share a little bit about their role on these funding announcements. Thank all of the attendees for your time and the sort of fast and furious Q&A session. It's always wonderful to be able to answer those questions to all live on the line. I want to emphasize the point about reaching out to your POs. Again, the contact information can be found on those individual funding announcements or by emailing David as offered, or by emailing the team at the NCI Implementation Science email inbox. As a quick note, an archive of today's session will be made available online. It takes approximately 10 days to get up, and we will post that and share it widely in our newsletter and on Twitter, so keep an eye out for that. Thank you so much. You may disconnect this time.
Thanks, everyone.
Thanks, David.